it's so hard, almost impossible to get out of a situation where you start from um, being in early recovery, not even trusting this new person that you are sober, or being able to rely back on the old things that you used um, to overcome those roadblocks and challenges. So that's what we're trying to develop now.
All right, welcome to The Boost, conversations with people promoting mental health. And I have put my radio voice on for this, as I always do. But I am legit excited to talk with Matthew Douglas from ZLD Partners. Matthew, how are you doing?
Good, Steve. How are you? Thanks for having me.
Yeah, for sure. It's great to see you again. I saw you in person at the Mental Health Marketing Conference. You all were a wonderful sponsor, and it was great to get a brand like yours there. We don't have a ton of those. We've attracted marketing agencies, and that's a wonderful thing. But this year it was technology companies and consultancies, and then to get the construction side and what you all do, which I'm not doing it justice by calling it the construction side of things, but in my brain, that's a little place of where it sits. And I can't wait to learn more from you today about what you all are doing. But before we get into all that, we'll start the way we always start, which is the virtual hug and the shameless plug. So the virtual hug is tell us somebody or something you are thankful for today.
Well, I think I'm, going to keep with on trend for the podcast and kind of I'll do two things. One of them is definitely on trend, but very grateful for my spouse, my wife, Sarah. Starting a new business can be very hard, and I had no real framework for getting there kind of emotionally. And there's been lots of emotional up and downs on my end for the past 6, 7, 8 months now. And so she's taken that in stride, and I love her for it. And my team, we're about 10 people strong now. We're ready to, kind of kick it into high gear on first quarter of next year. So we've been building up a, structure. And I guess I'll kind of lead into the shameless plug. So we're ZLD Partners. We're basically the partnership that we have is between myself, Michelle Lubert, and another partner in Wisconsin that owns a general contracting firm. And, Michelle and I worked in substance abuse for many, many years, primarily in real estate development for one company where we scaled that growth. And so we come out of that situation with the idea that we could take, kind of that playbook and apply it to other providers, while also offering like other fee for service type stuff like market studies, sourcing analysis, of course, construction. And then here newly in the last month or so, we've kind of moved into positioning ourselves to go into full operational readiness as far as the need that we see in the market. And the experiences that we have kind of pushes us in that direction. And so I've been building out a team on that end to serve as kind of a managerial operation that would serve over top like back office stuff for an inpatient or outpatient treatment center.
So full operational readiness being, you staff up the site, or like unpack that a little bit more. What's that offering?
Well, setting up that business unit it's difficult because you just don't know. We know where we want to go, and we know how we want to get there, but it's about assembling a team that's aligned with the mission and the values of the company. We're very focused on scaling Medicaid beds in the United States, and where we can, because there's places that you just can't because there is no expanded Medicaid. So teammates that are really on board with that. And so you have to cover certain key areas like your medical, your clinical, your revenue cycle, just administration, managerial type stuff. So, we've brought some people on board, and we've been building out the strategy these last 3 or 4 weeks, really. And now we're starting to shop the strategy to other folks because, we started out operationally being able to fund ourselves for the real estate side and the construction side. And, we have those operational funds kind of set aside. But for the operation stuff that just kind of came about recently, we're seeking a partner for that. So we want to put our best foot forward. And I think we're on the right track there.
Yeah. So you're growing and maybe pivoting your business a little bit, or at least expanding in service areas based on the demand you're seeing and spotting, and then attracting the right partners or capital for that. Walk it back. You said 6 or 7, 8 months ago. It's been a little bit of an emotional roller coaster. I mean, I'm on the car right behind you. We've been running the mental health marketing conference for 5 years now. As long as I've been a part of it, it's been around for 8, going on 9 years. And it's now something I own, and we're launching this new brand, Turn Productions, which is like event planning and production, as an outcropping of what we do well, and developing a playbook, like you said. But what was the impetus for starting the business? Like, walk it back to the beginning, and then walk us through the journey a little bit. Like, what were the ups and downs, or the surprises that maybe you didn't expect or weren't ready for when you were launching your company?
Yeah, well, that's a big question.
For the next 35
Yeah.
minutes, Matthew is going to talk.
Well, I think the impetus was, that the company we were working for initially, that I worked for about 6 years, was experiencing some issues, and there was an opportunity there to provide these services based upon, a lot of the pitfalls that we had experienced along the way. So there was an enormous amount of I guess you would call it lessons learned over 5 years of doing real estate development, construction, and program implementation for upwards of, at one point I had 22 to 25 projects going on at a time. Very, ambitious growth strategy that we were supporting there. So when that kind of wound down, Michelle and I had been talking to her for a few months about doing this, and we kind of just hyped ourselves up, and exited one day. I think I exited first, and she exited maybe a month or so after. And then we started really building up what we were going to do, and what that team looked like, and what services we were going to offer. And, so that's the impetus of it. But what it has become is something that I really couldn't have anticipated. I think that you can appreciate that, you absolutely have to be malleable, and, and not so rigid in how you run at least a startup, because there's going to be opportunities and just things that present themselves for you to take that quick pivot to, and address quickly, and hopefully capitalize on. So, we have deep experience in kind of all 3 of the business units that we're running now, and it just makes sense, from just the straight real estate side, understanding what markets that other operators could potentially be successful in, what those properties need to look like on the front end, and how that weighs into calculations of things like your total development cost per bed. So your acquisition of a facility, or your maintenance of it, if you're renting it, has big implications into how quickly you can break even and become profitable. So, we kind of know that strategy there. And then on the construction side, we were mostly owners reps, which an owner's rep in construction is basically, the owner's representative. They're there to act in the best interests of the person signing the construction contract, and then administer that along the way. So when we partnered with Jason, our other partner who had the actual boots on the ground, we were able to offer that full general contractor nationwide for folks that, our specialty is called, it's adaptive reuse of facilities that are, have that applicable square footage, layout, design, that lend themselves to being able to, be turned into an inpatient center. And it doesn't take a huge amount of money to get there. And then, the third thing is the operation stuff that, I'm building out right now and getting ready to mash the accelerator on is, I've been a patient in these places in another life, and I ran for three different companies, multiple centers on the operator, executive director type side. And then we've brought in a number of people that have been in that place too, even on, managing multiple substance abuse centers. So the reason we did that is that it's really simple. It takes a lot of the risk out of it for us when it comes to partnering with people that are new in the space, I guess,
Mm-hmm.
and being able to leverage our experience and the day to day that we had for so many years across multiple team members. It adds up to decades of experience in what to do and what not to do, and most importantly, setting yourself up for success. And, we initially started that out as like an operational consulting firm. So like we were going to consult, and you were going to come to us if you're having problems. And, we got a few months into it and put some money into, reaching out to people and everything. And basically came to the conclusion that, operationally people think they can solve their own problems, and they're probably right, because they have qualified staff, clinicians and professionals. And so from a business standpoint, it kind of floundered a little bit. So we took the pivot and then took the leap to kind of move into a strategy that would allow us to not only develop but operate and manage treatment centers.
Mm-hmm. Yep. Okay. So you have the real estate side, construction side, and then the operational activation side. Um, I've had some experience in a past life sourcing general contractors for a different industry where we were very good at doing, market analysis for these businesses and, getting kind of the radius footprint and the market flow and traffic flow and everything like that. And we would provide architectural and even engineering, oftentimes nationally, which is a trick of its own. But the GC side of things, it was always so sticky. Like it was always such a rough ride. What and you mentioned you have a third partner. I've met Michelle also, but I don't think I've met your other partner. What is it about the GC side that you all provide that's high value, or that's a little bit different? Because I don't want to make a broad generalization. It's just my experience that happened over and over again that I started to develop an opinion.
Well, I think it's taking the general out of general contractor. This business unit is very focused and specific in what they do,
Mhm.
and we've come up with a process that's very much repeatable. So, there's multiple layers of regulations that you have to kind of conform to when you're doing substance abuse treatment or anything healthcare. Square footage per patient, how many toilets you have to have in the facility, and it varies by, et cetera, right? It varies by state. It can even vary by city. And then you also have another layer on top of that for your licensure standards that oftentimes have physical plant requirements that have to be conformed to. Then you have your accreditation. So Joint Commission or CARF, some other accrediting body like that, they also have certain standards. So, multiple layers of things that on the front end that have to be taken into consideration. So it's all about proper planning and knowing what benchmarks you've got to hit in the beginning. Otherwise, on down the line, it's going to cost you time and money. So with construction, it's always about time, money, or quality on a job, and you generally don't get all three at once. So anytime one of those kind of is leveraged a little bit too hard, it's going to cost on the other one. So longer time on the job costs more money. For instance, if you're not doing the proper planning up front. So, we do that very specialized general contracting work, which is to take a facility that generally, it's a senior living, a physical rehabilitation center, memory care, something like that, and adapting it to substance abuse treatment. And it takes a little bit of a learning curve to get there. So, through our work with the former company, we basically taught these guys how to do this work from the design standpoint. At least what is in our heads from being former operators is like lines of sight, controlled access, safety of patients and staff, good outdoor space, just what an intake looks like, how you process somebody from intake to being on unit logistically, where you have to handle those first assessments, the first type of, I'm parting with all of my stuff and putting my luggage away, and, the rules, just laying out the physical space in a way that makes those things less, taxing than they already are on patients and staff.
Well, you can't beat, the more I learn, the more I think you can't beat experience. And in the addiction, SUD, and even in the mental health side of things, there's so many people who come from what they call lived experience, which is oftentimes a way to say, they had an addiction or something in their life that was having negative outcomes on their day to day. And and they address that, and they walk through that fire, and then suddenly they're not perfect. They are refined by that experience and so informed by that experience. And I don't think lived experience has to just simply do with addiction or mental illness or anything. It's life, right? I mean, you were at this company. It sounds like, if I'm inferring correctly, you saw some things that were maybe either missteps or things just not going the way that you would do it. And then you took the leap of faith and you said, hey, I think I can solve problems differently and more efficiently or better than this status quo that I'm in right now. And that takes a lot of risk and bravery to make that leap and then mitigate that risk with the people that you're working with. And it sounds like you've picked really smart people. And so you're making a lot of moves to help that landing soften. But it's just walking through it and to keep walking through it until we get to maybe some semblance of the other side, that then we can look back. Well, I mean, not to go on, but it's like Plato's cave. It's like we're blind in the cave. We walk out. The sunlight is so bright that we can hardly see. We get acclimated to that, and then we realize how blind we were, and we go back in, and maybe encourage somebody else to just realize where they might be at. And it's an old tale, it's an old lesson, but that's kind of what we're doing with this experience.
Yeah, I think you got to use the tools that you have, and somebody like me that comes from substance abuse history and recovery, and walking through that whole catharsis of change. What are you left with on the other side? I mean, I had various stages in my using life where I was considered what do they call it, like a functional user, or whatever. It's really a bad term. But I was holding, professional managerial type positions. But eventually that got to the point to where I was not a functioning member of society. And so it's hard for somebody that's coming into recovery, that has been in that position, to kind of see that light at the end of the tunnel sometimes, because you've been, acclimated to this basically forgotten person in society, and that that you're just another, I guess, drag on it. A lot of times that people come out of recovery, they get through that first month or two, and the pink cloud starts to lift, and their brain starts to make some new connections, et cetera, et cetera. And then there's that, you know, real come to terms, holy shit moment of what am I going to do with the rest of my life? What does the rest of my life look like? And I always, for people that, bring that to me as a concern I always lean back on what you've experienced and how best can you utilize that, not only to help yourself, but in this very specific case, to help other people. Um, so it's just natural, I think. But that first type hill to climb is basically that you can do this. You can turn your experience, even how traumatic or harmful that was to yourself, your family, and your friends around you. Once you get to the point to where you're making sound decisions in your life again, you can definitely use that experience for good.
Mm-hmm.
So
Mm-hmm. Yeah. And that seems like more often than not, the way to square the impact of the experience is to care for yourself, love yourself, and then also care for people around you. And maybe one of the big secrets in mental health care or therapy is simply finding affinity. As much as we want to talk about different modalities and programs, at the core is finding affinity, which to me means more and more somebody who gets where you're coming from and can meet you right there and give you that space to be there. And then in a sort of a game theory kind of way, where, if you play a game for the first time, you're more likely to lose than if you've played that game before, because you know what to expect. And so you know how to react to the things that are coming. Whereas the first time you don't know what to expect. And so you don't know how to react necessarily. So there's just broader guesses being made. And when it comes to, affinity with your therapist or with somebody walking through an addiction with you, then it's more either they've lived it or they've studied it enough to know this is a path forward, potentially, that you need to choose on your own and you need to walk through it, but here's some obstacles and pitfalls and speed bumps that you might hit along the way.
yeah, it's interesting that you mentioned that, because it connects to kind of two things for me. One is the recovery process. It takes time to get there, right? But if I take it back to active addiction, um, you become illogical, basically. I guess if you're a thinking person, I would generally relate it to becoming illogical, because the drugs, alcohol, or whatever the substances that you're using to change the way that you feel, um, will completely change the way that you look at people, places, things, situations. And then your decisions, even though that you might present as a sound person, will definitely overtake to the substance side. So when people describe active addiction as insidious, which is a very, it's a menacing word, but it just means something is coming at you that you don't anticipate, or you don't see it coming, and it is affecting your day to day, without you even knowing it. So, getting from that mindset to, a mindset of recovery in an individual is very difficult. And it might look as simply as, I don't have a problem, in that insidious type stage, when objectively you do, to, again, like using what we've learned and that experience that brought you from that nature of, I know what I'm doing, but I'm dying, to, now I kind of know what I'm doing, and I can probably tell somebody some good things to get them on that right track. So
Mm-hmm.
it's an interesting
Mm-hmm.
dichotomy.
It is, and uh, it's not easy to unravel. There's There's a saying, by this author, Nassim Nicholas Taleb, it's not the crime, it's the cover up. And, all that to say that, it connects to two other ideas. One is from Jung, which is what you resist persists, so you can try to hold it down and keep it back. But also the thing my therapist told me was the mask is the opposite of the face, so we try to project this functioning, and we have incentives to do that. We have either family or friends or coworkers or companies that are relying on us, clients that are relying on us to deliver certain things, and by certain metrics, I agree with you about that term, but it's like, by certain metrics, you're achieving what you need to achieve. But what is under the surface? What's behind that mask, or behind this attitude of like, oh, I'm perfectly fine. That may need to be explored or uncovered and brought to the surface at some point to be dealt with.
Yeah, and that's the challenge with recovery, right? I mean,
Mm.
it that type of it, I would say 9 times out of the 10, it generally people that are entering inpatient treatment, especially for the first time, are absolutely resistant to it because, again, a certain portion of that population is going to not think that they have a problem at all, or that it's at least manageable, or it's normal. My dad drank like this, and he's fine. And so it's dispelling that myth. And unfortunately, a lot of the times there is an extreme amount of pain that a person has to walk through before they get to that inflection point to accept outside opinion or help from somebody else that has lived it before. So the question is like how you get there, and my answer is that it's different for every person, and it's like it depends, it depends, and you can't really put it into a scientific calculation or anything. You might be able to get trends on that, but again, the person is so um, unique, and that I don't know that if you can ever approach or ever gauge what somebody's recovery journey is going to look like once they kind of open that first door.
Hmm. Yeah. Yeah, that's a common message I'll see in people who are post recovery, and oftentimes pretty fresh post recovery, is to get pretty dogmatic about a certain treatment, and then in the next paragraph it'll be because this worked for me,
Yeah.
and I love to read that it worked for you. I love that, and at the same time, it's difficult to, from an outcomes perspective, to say. Therefore, it'll work for everyone. It's the idea that the absence of evidence is different than the evidence of absence, or the evidence of outcomes is different than the outcomes of a universal application, to kind of twist that around a little bit. But from an industry growth perspective, I'm curious. You've talked about SUD. You mentioned Medicaid. You talked about sort of transitional housing in the green room ahead of this. Like, from your company's perspective, where do you see sort of the major challenges or growth areas, for a company like yours as it relates to where do we need more treatment centers and more SUD locations, either across the country or to address certain, addictions or challenges?
Yeah, so that's a really good question, and I'm probably not going to give you a straight answer because I don't know. I know that what we're going to do, and that's what matters most to me, and that's based upon our mission and values. Um, I don't know if you've heard of the Kennedy Forum, but Patrick Kennedy was a longtime serving member of the House of Representatives, and they recently got some legislation passed for medical parity, but um, parity for mental health rather, so that insurance companies and certain payers, they can't basically um, have bias against mental health treatment. That's what that group does. My point is that we made a commitment to the Kennedy Forum to provide 2,000 Medicaid focused treatment beds over the next decade.
Hmm.
And so, like, I don't know what company X or company Y or company Z or nonprofit, non governmental entity or whatever is going to do over the next decades, or what the treatment landscape is going to look like. But I'm pretty sure of what we're going to do, and it's going to increase access to the people that need it the most. And in my estimation, I mean, well, it's hard to say that one person doesn't need it more than others, but the people that do not have the resources or lack basic hierarchy of needs being met is our very pressing focus at the moment. And that comes from a very personal background. Um, you bring up a good point as far as there's such a wide range of ways that a person could come into this recovery community, right? Um, there's some that are rigid, some that are more a little bit what you would call new age and whatnot.
Mm-hmm.
Um, there's no one size fits all, I believe, but the common denominator that I think between all of those different, let's call them treatment modalities, is time. And that's backed by science. Over time, a using person begins to create neural pathways within their brain that makes connection to the substance, the releasing of that dopamine, right? That it brings, and that connection, as far as like that happiness connection, becomes very, very solid, and then very entangled in how you feel about, again, other people, yourself, and the world around you. You definitely become a completely different person than the person that you were wired as going into it. And so, assume a person has been building those pathways over a decade. I think logically that it would be a pretty bad bet to assume that a person going to 30 days of treatment is gonna be cured after that. There's certainly lots of opportunities to set somebody up for a path of success, but generally in the first 30 days, you don't know if you're coming or going, and you're probably have a lot of medical issues that need attention, and then most people have co-occurring disorders that need to be stabilized from a mental health perspective. So my contention is that it's the time is what hinders us in substance abuse treatment, and our ability to not keep patients in a sphere of influence of recovery for an extended period of time definitely influences that patient's outcome. I mean, you can
Mm-hmm.
just think about it, like logically. What are you good at? What? How long did it take you to get there? You know, like you weren't good at driving a car at first, but after a certain amount of time, you become a driver where you can listen and think and do multi things. I mean, keep your eyes on the road, right? But I'm not constantly focusing about when I pick up my foot off the accelerator pedal and put it on the brake pedal. Think about being a dad. It takes a while, a little bit, to become confident that you're being a good dad day to day. Just things like that. I play the guitar. 10,000 hours on the guitar. Right? I wasn't very good plunking away at it when I was a kid, but now I can pick a tune or two. So it's time is the factor that we're fighting against. And I mentioned it was personal because about a decade ago, when I eventually came to the end of what I didn't know was the end of my, using journey, found myself in jail, ordered to drug court, and then had drug court mandated treatment at a homeless shelter. I wasn't too thrilled. And that was a 6-month program. and I did it twice because I'm a real obstinate type. So um, I spent a good year in treatment, and then I worked for those people for another 18 months. And that was the Hope Center in Lexington, Kentucky. But one thing that I did there is I took advantage of every opportunity that they had along the way, and that was the inpatient treatment portion of it. There was an outpatient component. There was a, like a phase 2 component of it. But the biggest thing that I took away from it was the housing portion of it. I was able to come out of treatment, transition into my own little apartment that I shared with somebody, and then eventually transitioned into my own apartment and lived there for about 6 months. And all the while, I was within a recovery community, and my brain was changing those connections and everything. And I was making better choices. I had a lot of people around me that I could connect with and talk to and share. And if I didn't have that time, and let's assume I didn't have anywhere to go, I don't think the outcome for me personally would have been as where I am now. So that leads me to some of the problems that we're trying to solve on the operational provider clinical side, and even just logistics side, that I think that we're missing in substance abuse treatment today, which is, you can bring some folks into a treatment center, and their payer or Medicaid or whatever is going to pay for 28 days of treatment, right? They'll probably pay for good another 3 months of PHP IOP type treatment. But what if that person has nowhere to go after their first 30 days? They don't have familiar support. They certainly don't have housing support. They don't have any. They have food insecurities, things like that. So what happens to them? And they just rejoin the cycle, because it's so hard, almost impossible, to get out of a situation where you start from being in early recovery, not even trusting this new person that you are sober, or being able to rely back on the old things that you used um, to overcome those roadblocks and challenges. So that's what we're trying to develop now. Lots of nonprofits do this, and they're able to do this through various means, but we want to try to do it kind of on the private side, and at a larger scale than some of the sober livings that you see that are in the house or something. So, our plan is to open up treatment centers with adjacent apartment building, multifamily type home that needs just like the same thing with the treatment center. It's a distress asset. It needs some work, right? We can acquire and manage an entity kind of like that at a fairly cheap cost, and then subsidize through revenue from the business that journey for the people that need that transitional housing. And I'm not talking about subsidizing with Medicaid funds or anything like that. Other, very distinct, different revenue streams, but not taking all that money and then putting it back into, the owner's pockets or whatnot. That's just not what we're here to do. There's a lot of research on this as well. And I think it's been pretty consistent, even from the early 90s, when people start tracking outcomes, that the length of time a person is in treatment directly relates to their treatment outcome. And the length of time that you can influence that thinking and generate these new neural pathways, these new connections to joy, and people are going to be better for it. And it's much needed. So yeah, I talked for too long there.
No, you didn't. No, you didn't. You talked for a long time, not too long. Yeah, man, there's a lot in there. Such good stuff. I had the chance to have dinner with Rebecca I don't know if her last name is Bagley or Badgley. She's the president and CEO of the Kennedy Forum, and she talked about her own family experience. And I've heard Patrick Kennedy talk twice, and he talked about, running out of insurance for his own care, his own journey, and he was the Kennedys. But the Kennedys, I think they're carrying the legacy on of JFK's vision for Camelot, really, which is, yes, get to the moon and, basically mental health care coverage and a safety net for everyone who's in need of it. And mental health being the big broad umbrella of all everything we're talking about. And then that fractured down to the state level, which was unprepared and unbudgeted to accommodate that care. And my belief is that it's going to have to be sewn back together in the private sector from the ground up. And to hear you talking about what you're doing with this sort of transitional housing, which, not to oversimplify it, but yes, the amount of time I spend in a gym doing things that aren't breaking my bones, but they are bending and pushing me, uh, correlates directly to, how much muscle mass I build. And the grooves get really deep when you start to activate dopamine in other ways, and it's always firing. There's always this serotonin mixture or cannabinoid mixture with dopamine in our mind. But when we go down these certain roads, the grooves on the record, is how I describe it, get pretty deep, and the needle has a hard time jumping out of that. And so reworking that over time is the greatest challenge, because 28 days is hardly enough for anything, not to mention the complexities within our mind and reconnecting synapses, in an order that, is more beneficial to our goals, rather than the addiction that we're tied to at times. So it's, when you said that about the apartment complexes or the housing next to, an addiction or an SUD center, or something of the like, that really got my attention, because that is exactly the kind of knitting that we're going to have to put together for people. And I'll say you were lucky, I think, from my perspective, to have so many people around you and resources that not everybody can access or gets access to, social determinants of health, and, where you're at in the country, and all sorts of complexities. But the more we can rebuild that foundation, that is the stack that we need to help people play the long game, which is also the big advantage. Is if you can continue to play the long game in almost anything, the benefits tend to fall in your favor.
Yeah, no, I completely agree. There's treatment deserts out there, even in larger DMAs, populations adjacent to them. There's definitely deserts where somebody looking for treatment with limited means is unable to get them, and then they're unable to travel. They're unable to uproot and go to a place where they can get treatment. Think of how difficult that would be for a family uh, that that has to go to a different state or city to be able to be treated for their mental health addiction issues. I was very, very lucky to be in Lexington, which has a very good recovery community, and the Hope Center had been around for 30 years at that time, and they're connected to a larger community there in Kentucky called Recovery Kentucky that has nonprofit long-term treatment centers where they get folks and they will treat them for 6 months, in a program.
Mhm.
Um, but that's generally a non-clinical program. They very rarely have clinicians, therapists, things like that. It's peer run, and it's based upon one modality of treatment. We look to, again, try to open up that a little bit, be more clinical, be more research based, be open to multiple ways for somebody to get sober, including medically assisted treatment, um, and give them a place where they can come and be, respected and cared for as long as that they need to, and then given the ability to go on to the next stage of their life. Um, I think that's so crucial. The good thing, Steve, is that there are people out there in the private sector that feel the same way. And so funding for things like this is there. I mean, we can get the money to go into a market and acquire a facility for inpatient and acquire a, some type of rental situation um, with very little, pushback. Of course, you have to go through the normal entitlements and the not in my backyard type stuff. And there's a lot of community education and public outreach around things like this. But at the end of the day, there are folks out there that, control the purse strings, if you will, that do want to do this good work and will do it. It's just a matter of getting other people to kind of join with us and embracing it, which, I think that's one of the pitfalls that the industry is trending into. Um, I think that there's a lot more room for collaboration rather than competition, and especially, we're not out here selling widgets, or I'm not out here building McDonald's or anything. I'm wanting to build community and connection between well-meaning people that want to affect long-term change. Um, and it's surprising to me that there's not as much collaboration, and people do keep a lot of things so close to the chest, which, okay, it is what it is. But my point is that there's a lot of folks that do want to get involved and do want to, recognize that having a person within a recovery community for, let's call it 18 months or less, um, really drives outcomes. And and outcomes is an interesting word too. When we start talking about mental health and substance abuse and behavioral health, because nobody tracks the same outcomes. Nobody has the same data points or metrics, and you'll get anecdotal things like 60% of inpatient treatment fails. Well, yeah, absolutely. I believe that. I bet it's less than that. I'd say it's closer to probably 90% over a longer time span. But that's what I mean by the recovery community and providers, and even on the governmental level, we have to start tracking the same data points and start trying to understand what clinical treatments are effective, and then begin to move and fund those treatments that prove out after analyzing, the data from these outcomes. Now, I can make a hypothesis of how, previous research relates to what this new um, this new venture we're trying to do would look like, but I don't know. Nobody else knows either. Um,
Mm-hmm.
and what happens, and this is probably controversial, and I'm not gonna try to sugarcoat it, but you know, the providers and the clinicians and the people that do the work are at and again an inflection point of what the next decade, the next 2 decades, the next half century is going to look like in the mental health, behavioral health space. And that's going to be defined by the providers and the clinicians and the people that are doing the work on the ground, or it's going to be defined by the people that are paying for the treatment, which are the payers and people that are making policy at a state level regarding how much money from their expanded Medicaid will go to substance abuse treatment. And our only um, standing point and argument is outcome data. And if we can't come together and start presenting outcome data insofar as how, especially inpatient treatment influences a person's mental, medical, and behavioral health such that the strain on the system is less if they get into treatment earlier, then those types of decisions on what type of treatment is covered, how it's covered, who it's going to be covered for, are not going to be, those decisions are not going to be made by us. And I don't want to make it an us versus them argument. It's just an argument that's happening that's based on bad data, you know? Like imagine if you were trying to have an argument or a discussion about who's the better basketball player, LeBron or Michael Jordan, and you don't have any statistics behind it. Like you have no clue. You mean you could just watch them on screen or something, kind of shoot around or whatnot, but you have no clue of like historical data on that. Like, so who's right or wrong? I mean, in that situation, that's why I'm not trying to say, um, it's an us versus them when it comes to payers, but for the operators and the people that are practicing, um, if there is not a confluence of cooperation within the next, in the near term, we're going to be at the mercy of decisions made purely based on fiscal reasons that affect patient health.
Mm-hmm. Yeah, I mean, even at the the government level, I mean, the guidance from CMS on what to collect, in the home, or what to collect with various treatments. A total it's a total crapshoot. There's no guidance, it seems like. And I sat in a presentation not very long ago where that was said from basically from that department, which is like, hey, we don't have it yet. We got to get a lot better about standardization of data in order to be able to compare things to other things, with any semblance of statistical relevance. And then we get into incentive structures where I've doubled down my whole career on specific modalities. Well, I'm incentivized to continue that modality, and it does lead to silos, which we saw and still see mental health in a silo way out in the field from physical health. And the next 10 or 20 years, maybe we get much more informed about the brain as a body part. And, hopefully we have some data models that will allow us to do that complexity of analysis at levels that humans simply can't do. So there's a silver lining, I think, lately around that pursuit, organizations and people who are really going down the let's look at it all from a biological standpoint. Not that it's the only standpoint, but certainly we need more information there in order to suss out, to your earlier point, that some treatments aren't for everybody, and some are, and why is that? We need a lot more information, and that's a biopsychosocial problem. We need to understand what's going on with the body and the emotions and decision making, and the context of where this person is and what their relationships are. So not to default to like, well, it's too complex of an issue, but I can understand why there's competition, and some of that may be healthy competition to see who evolves the fastest, or who adopts the quote unquote better modality, or like even Thomas Insel, who was at the National Institute of Mental Health running it. He talks about like electro treatment, basically, as like, driving certain outcomes that are fairly positive, from a data perspective. So, um, yeah, I think it's a fascinating point you bring up. I certainly don't have the answers for it, but
I
um,
don't think anybody has the answer. I think the impetus has to come from government, and I believe what you experienced regarding the information that you received. And I was in D.C. last week for a conference. Our booth was right next to the National Institutes of Health, and I attempted to have a conversation about this very issue with the person that was representing them there, and it was like uh, we don't do that. This is we don't do that. So yeah, I mean, I say this a lot. Like, I don't know what's going to happen, but something's going to happen. You know, and if we take history as a guide, we'll kind of, we would be better off if people got together and had real conversations regarding how we present and collect data. Otherwise, somebody else is going to be making decisions about how you treat and operate for you.
yeah, and then it's follow the dollar, certainly.
Yeah.
Well, Matthew, thank you very, very much. I could continue talking with you at length, but I want to thank you for being on the show, and it was a pleasure, and look forward to staying in touch with you. But I learned a lot today, and I appreciate your insight.
Yeah, Steve, it was great. I really enjoyed the conference this year. I think the time and attention that you guys put into the holistic nature of it, the production value of it, is really great. And I also believe that your new venture, so I'll plug that for you, is going to turn out well as well, because I know that you care, and you really you are there day to day, kind of making that happen, and your team is excellent as well. So yeah, hopefully in a couple years you outgrow that Franklin location, and we could bring the mental health marketing conference to Bridgestone or something crazy.
Hey, we keep walking this path. I appreciate that so much. And we are going to make it, do everything we can to make it better next year. And it does continue to grow year over year, not because we focus on that kind of growth, but we double down on trying to improve the experience and listen to what we can do better. So I appreciate that, and excited to track along with ZLD too, as you guys continue to grow and take ground. So let's stay in touch.
Yeah, man. Great talking to you.
Sounds good. Likewise. See ya.
Yeah.